This presentation is about dissection kits and surgical instruments. We will go over the types of instruments you will be expected to know, not only for anatomy, but also for clinical skills and what their uses are. This presentation was made in conjunction with the clinical skills team. We'll start out by going over the instruments that are in your dissection kit, and then we'll move on to talk about some additional instruments that are used either in lab, in clinical skills, or in surgery. The dissection kits that you purchased are used during lab periods and will contain the following types of instruments: scalpel handles and scalpel blades, scissors, thumb forceps, hemostats, also known as hemostatic forceps, a probe, and a needle driver. The following slides will provide you with a quick overview of these instruments and what they are generally used for during dissection labs, as well as clinical skills and surgery. Here you are seeing images of scalpel handles and their associated blades that go with each different type of scalpel handle. And scalpel handles are used in conjunction with the scalpel blades for incising tissues. Now on the scalpel handle, you'll note that this kind of pointed end here is where the scalpel blade actually goes onto the handle. So in each of these pictures, right there is where the blade actually goes onto the scalpel handle itself. Now the blunt end will refer to this end here as the blunt end of the scalpel handle. So here would be the blunt end of the handle. The blunt end can also be used to scrape large amounts of muscle tissue off of bones and to aid in your dissections. And it is especially helpful in removal of the brain in your animal cadavers. There are two different sizes of scalpel handles that are in your dissection kit. You have the Bard Parker number 3 and the Bard Parker number 4, which are both pictured here. The Bard Parker number 3, we'll start over here on the left, is the handle that is most often used in small animal dissection and in small animal surgery. This handle will fit scalpel blade sizes 10, 11, and 12, which you see here, and also number 15 blade. Size number 10, right here, is the most frequently used blade for incising skin and tissue, transecting muscles and tendons, etc. Then we have the Bard Parker number 4 over here on the right. And this is the handle most often used in large animal dissection and large animal surgery. And this handle will fit scalpel blade sizes number 20, which is not pictured here, and then 21, 22, 23, and 24. Size number 22, right here, is the most frequently used blade with this handle and is used for incising skin and tissue, transecting muscles and tendons, etc. Here we're just taking a look at some of the general instrument parts. On the left you have a scissors, and we'll look at some of these parts. We have the handle that will then have finger rings so that you can put your fingers in to hold the instrument. We have the shanks. So here's a shank and another shank. And then those two shanks are joined together at the joint. And then you have the blades on the end here. Then on the right-hand side, we have a hemostatic forceps or hemostat. And so here you have that handle region where you have the finger rings where your fingers go in to hold it. And you also have a ratchet in between the two sides that will help to lock that shut. Then we have the shanks, and the shanks are joined together at the box lock. And then you have the jaws. Here we'll take a look at the scissors that are included in your dissection kit. Overall, there are many varying types of scissors, all with different uses, weights, and lengths. But in general, your scissors are used to cut and separate tissues, and also to cut suture and drape, etc. The blade of the scissors may be curved or straight, and the points may vary as well. The point combinations can be sharp, 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 blunt, or blunt, blunt. And you'll see what I mean when we take a look at some different tips on these scissors. So on the left, you have Mayo dissecting scissors that are in your kit. And these have heavy edges and blunt, blunt tips. So when you look at the tips, you can see they're kind of rounded on the ends. So those are blunt, and that's blunt, blunt. And these scissors can be curved or straight, but in your dissection kit, you'll have a straight pair of Mayos. These are a crucial tool in dissecting, and they're often used for dissecting out nerves and blood vessels, but they're also useful for cutting through tissues, muscles, and tendons. Now on the right-hand side, you have your small iris scissors. Now these are a small, sharp, sharp scissors that are very pointy. So here you have the point on the tips, and that is sharp, sharp. And these are used for intraocular tissue or other delicate work, such as in surgery when you're incising the iris, as is done in cataract surgery. And these can be curved or straight as well, and your kit will have a straight iris scissors. Now for dissection, this tool is very helpful in separating and defining the various tissue planes in your dissections, as well as using it for dissecting out delicate structures like vessels and nerves. Now we'll take a look at the thumb forceps that are included in your dissection kit. Thumb forceps can also be called pickups, and these are used for grasping and holding tissue. There are 3 different types that you'll find in your dissection kit. You have a dressing forceps, a tissue forceps, and an Adson-Brown forceps. Here we're looking at the dressing forceps on the left, and these forceps are referred to as your smooth tip forceps, since they don't have the ragged edge of teeth on the grasping surface, but instead they only have these horizontal serrations. You can see that in this image here. So you see these little lines going across, these horizontal serrations. And these are typically used for grasping more delicate tissues like nerves and blood vessels while you're dissecting. Then on the right-hand image, we have tissue forceps, and these are rat tooth tissue forceps. There are a few different varieties of this type of forceps, but each will have a tip with the rat tooth on the end of the grasping surface. You can see that here in this little inset circle. And here's that little rat tooth. And the teeth at the tip of this forceps fit together like puzzle pieces when the forceps are squeezed shut. These forceps are often used in dissection and help grasp and hold various tissues and muscles. Here we're looking at more thumb forceps, and we're looking at particularly Adson forceps. All 3 of these that you see in these images are Adson forceps, and the characteristic look of Adson is that they have this narrower tip as compared to the other forceps that we saw. So a narrow tip that then broadens into these shoulders, if you want to call them that. So it goes out, and it looks kind of like the neck is here, and then the shoulders go out. So all of them have shoulders and narrower tips when you're comparing them with other thumb forceps. And the Adson thumb dressing forceps on the left have those horizontal serrations in the tip and are used for placing or removing dressing on wounds. And then in the middle, we have the Adson thumb tissue forceps, which have a little rat tooth at that grasping tip here. And those are used for grasping tissue. And then on the right-hand side, we have the Adson-Brown thumb tissue forceps. And those have a 9-toothed platform at the tip, which you can see this little inset image is showing right here. And there are 2 parallel rows of 9 shallow teeth that then fit together when that forceps is squeezed shut. And these are included in your dissection kit and are basically a general surgery tissue forceps for grasping and holding tissues. Here we'll take a look at some hemostatic forceps, which are often just called hemostats. And there are many varying types of hemostatic forceps, but in general, this is an instrument with a ratchet device and a box lock to bond the two shanks together, and the jaws can either be curved or straight. These instruments are used to clamp, hold, or retract tissues and tissue bundles, as well as blood vessels during surgery. We'll start on the left with the cryoforceps. And now these are a larger version of what you're seeing, the mosquito forceps here in the middle. So the cryoforceps are a larger version of that, and the jaws can be curved or straight. So here you can see in each of these images, you can see that all of them can either be curved or straight with the jaws. And the horizontal serrations on the cryo are on the inside of the jaws, and they go all the way down. So you have horizontal serrations that go all the way down the length of the jaws. And these are used for hemostasis and blunt dissection and tissue retraction. Now we'll take a look at the Halsted mosquito forceps in the middle. And these are smaller forceps, typically 3 to 4 inches. And the jaws can again be curved or straight. And these have fine horizontal serrations, very close together, and they're on the inside of the jaw all the way down. So these again are just a smaller version of the cryo forceps. These are used to clamp small vessels, and they can also be used for blunt dissection and tissue retraction. Then we have the Kelly forceps on the right-hand side, and the Kellys are the same length as the cryo forceps, except the horizontal serrations only go halfway down the tip on the inside edges of the jaws. So you can see here in the Kellys, you have horizontal serrations, but then they end right here, halfway down. So the Kellys can also be curved or straight, and they're used to clamp medium-sized vessels or small tissue masses, and can also be used for blunt dissection and tissue retraction. Just to note that there are numerous other types of larger forceps with varying serrations and teeth combinations that are used for more aggressive grasping and clamping uses. The instrument you're seeing here is the Huber-Mall probe. And a probe is a long, straight instrument with a blunt tip. So you're seeing at the end here that it's a rounded tip. So that's a blunt tip. And it's used for blunt dissection and often just for pointing to items, holding, elevating, moving things around on your dissection field of view. And also, it's good to note that probes tend to get lost very easily during lab periods, so be sure to hang on to your probe. In your kit, you'll also have a needle driver, and here we're seeing the type that you have in your kit. It's the Mayo-Hagar needle driver, and this is used to hold suture needles and scalpel blades. You use that to put your scalpel blades on the handle and also to take them off. And you should note the short jaws with the rough surface and the hollow center. So here you're seeing the inside of the jaws. This is what the surface will look like. It has that roughened surface, and then you have that hollow center in the middle there. There are a few other instruments that we use in the anatomy lab that you should be familiar with. Here on the top right, you're seeing the snips or the pruner, which is not a surgical instrument, but we use it in the anatomy lab for cutting through typically the ribs and things like that. Then we also have rongeurs of varying types and descriptions that are basically bone cutting forceps that you're seeing on the left. There's a couple of different types here. And the rongeurs are used for cutting bone periodically in the lab. We don't use them all the time. Then we also have the backhouse towel clamp that you're seeing on the bottom here. And clamps like this are instruments with pointed tips on the jaws. And mainly we use the backhouse towel clamp for holding back skin while we're dissecting. But in surgery, it's also used for securing sterile drape to the patient for the duration of surgery. Then you might also use giggly wire, which is twisted sharp wire that can be used to saw through bone. Here's another instrument that you will use during the anatomy labs. And it won't be used all the time, but it's another tool for cutting through bone and hard to cut through areas. And it's called a striker saw. Now the striker saw has an oscillating head on it, so it's a power tool that you plug in. And here you can see the blade, and the blade oscillates very quickly. And so it cuts through the bone tissue very easily. There are several other surgical instruments that you will be expected to know in addition to your dissection kit instruments and the other various lab instruments that you'll be exposed to. These will include variations on hemostatic and tissue forceps, as well as scissors and needle drivers. And you should also be familiar with the different Spay hooks and retractors. So in the following slides, we'll go over a brief overview of these additional instruments. There are two additional types of hemostatic forceps that you should be familiar with. These are the Rochester Peen and the Rochester Carmalt hemostatic forceps. We'll take a look at the Rochester Peen first, and those are on the left-hand image. Now these are long and heavy, and the jaws have horizontal serrations going all the way down the entire length of the jaw. And these can be either curved or straight, as you can see here. And those horizontal serrations, you see them extending all the way down the inside of the jaw, down to the tip. And the Rochester Peen are used for general surgery, arterial hemostasis, and sometimes for blunt dissection. Now, the Rochester Carmalt is on the right-hand image. These are long and heavy as well, but the serrations on the jaws extend vertically up to that cross-hatched, roughened tip that you're seeing. So here you can see these vertical serrations, and then you have this cross-hatched, roughened tip at the end. So these can also be either curved or straight, and are used for clamping large vessels or tissue masses, arterial hemostasis, and sometimes for blunt dissection. One little note here is that sometimes it's easier to remember the Carmalt, the Rochester Carmalt, by thinking of a car driving down the road. So you would have a car driving down the road here, and you would not on the Rochester Peen because they're horizontal rather than vertical. Here are two more types of forceps that you should be familiar with as well. The first one is the Alice tissue forceps, and that's on the left-hand image here. The Alice tissue forceps is neither a hemostat nor a thumb tissue forceps. These have teeth at the tip of the jaws for grasping tissue. So if you think of it here, if you look at this inset image here and look at these little teeth on the Alice, if you think of it as Alice the alligator, because of how the teeth look, it might help you remember this forceps. The Alice tissue forceps are used for grasping tissue, and it's a traumatic grasping, and it's mostly for tough tissue or tissue that's going to be removed. Then on the right-hand image, we have the Doyen intestinal forceps, and these have roughened jaws, but they're thin and bowed, and they're used for more delicate, non-traumatic clamping. And these can be curved or straight. They're often used to occlude delicate tissue such as the bowel, preventing spillage of the contents. As I mentioned before, there are many varying types of scissors, all with different uses, weights, and lengths. In general, your scissors are used to cut and separate tissues, cut suture, drape, etc., and the blade of the scissors may be straight or curved. Here we're looking at two different types of scissors that you might see. You will come across an operating scissors, which you're seeing on the right-hand side of the slide here. And the operating scissors have points that may vary. So here, we'll look at the points on the tips here. And this one has a sharp, blunt combination. But the combinations on the points can be sharp, 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 blunt, or blunt, blunt. And again, these can be straight or curved. The operating scissors are ideal for cutting drape and suture, but they're only used for inanimate objects like that. Now on the left-hand image, we have the Metzenbaum scissors. And these have short, delicate, thin blades here, and a very long, thin shank. So here you're seeing the long, thin shank. These are only used on tissue. They are lighter and thinner than the Mayos, and they're definitely a crucial tool in surgical procedures. They're used for delicate surgical dissection and cutting of tissue. Now, if it helps you to remember, the longer shaft, so the long shaft could equal the long name. So the Metzenbaum has the long shaft and the long name. Here are two more types of scissors that you need to know. The one on the left is a suture removal scissors, and this one has one blade that is shaped like a hook. So here you can see the one blade that's shaped like a little hook right here, and that cradles the suture to be cut, and it's obviously for removing sutures. So that's the suture removal scissors. Then on the right-hand side here, we have the Lister bandage scissors, and this one has a bottom blade that has a blunt knob on the end. So here's that bottom blade, here's that blunt knob on the end. And that helps keep the bandage up and away from the skin surface when you're cutting the bandaging material. And it's used to cut off a bandage and avoid cutting the skin underneath. Here is one additional type of needle driver that you should be aware of, and it is the Olsen-Hagar needle driver. It's very similar to the Mayo-Hagar, but it has one key difference in that it has a built-in scissors in it. So the Olsen-Hagar is still used for holding the suture needle and also can be used for putting scalpel blades on and off your scalpel handle. And it has the same jaws as the Mayo-Hagar does. So it has the same jaws with the roughened surface and the hollow center to hold the needle. But it also has this built-in scissors right here before the box lock. And that built-in scissors is very convenient for cutting suture. So if it helps you remember the difference between these two, you could think of the S in Olsen-Hagar as standing for scissors. And that will help you remember the difference between the Olsen-Hagar and the Mayo-Hagar needle driver. Spay hooks are another common instrument that you should be familiar with. Spay hooks are used to find and exteriorize the uterine horns during an ovariohysterectomy, or Spay procedure. And here we have two different types. On the left, we have the Covalt Spay hook, and that has a narrow, rounded hook that you're seeing here at the end of a thin, round shaft. Then we also have the Snook Spay hook on the right-hand image here, and the Snook hook has a smooth, wide hook at the end of a long, flat shaft. We'll finish up by looking at a few different types of retractors. Now, there are many different kinds of retractors, but in general, they are used to hold open various body cavities such as the abdomen and stifle. On the left-hand image here, we have the Scalpel retractor, and this is a self-retaining retractor with single, sharp-pointed tips. So here you're seeing those sharp-pointed tips on the Scalpel. And the Scalpel is useful in orthopedic and neurologic surgery, but it's too traumatic for most soft tissue. Then over here on the right-hand upper image, we have the Balfour retractor. And the Balfour is a self-retaining retractor with smooth, curved tongues at each end. So here you have those smooth, curved tongues. And this can be used with or without the third or middle blade that you're seeing here attached. And the Balfour is used in soft tissue surgery. It's often used to hold abdominal walls and lateral retraction, providing excellent visualization of the abdomen. A third type of retractor that you should be aware of is the U.S. Army retractor, and that is a handheld retractor with wide, flat shafts turned perpendicular at each end. And they're used to pull apart the edges of an incised surgical site to give better exposure.